States across the country are preparing to receive those first shipments of the Moderna vaccines tomorrow. Ohio Health's top infectious disease doctor is now joining us to talk about this new weapon in the fight against COVID-19. Dr. Joe Gastaldo attended the Wright University Boonshoff School of Medicine and brings 21 years of experience to the war on the pandemic. Doctor, thank you so much for being with us tonight.
Thank you. Good evening.
Good evening. So first of all, how is the Ohio Health system preparing for the rollout of the vaccine? Do you feel ready? And what are you expecting in this coming week?
Well, at Ohio Health, we've been preparing for this for months. Literally, we've activated teams of hundreds of people. And operationally, it was a big lift, obviously. There's a lot of logistics with both vaccines. The Pfizer vaccine requires an ultra cold storage. The Moderna vaccine requires a regular freezer. But we've been preparing for this for a long time. And last week, we started vaccinating people with a Pfizer vaccine. And we look forward to rolling in the Moderna vaccine this week.
So you have a little practice underhand. An FDA committee just said today that people 75 and older should move to the front of the line and be next to get vaccinated, along with some of the frontline essential workers who can't practice social distancing. Previously, they had said 65 and older would come after essential workers. Why the change now?
Yeah, I think the change is more or less a reflection of the supply chain of the vaccinations. You know, yes, we want all Americans to be vaccinated or choose to be vaccinated, but it's going to take us many months to get there. And even when it comes to healthcare, it's going to take us to many months to vaccinate all the healthcare workers and those that live in nursing homes.
Have you been vaccinated yourself?
Great question. I actually go tomorrow at 8 a.m. for my vaccination.
Okay, so you're getting the Moderna vaccine tomorrow.
Actually, I'm getting the Pfizer
vaccine. Okay. So hopefully we can follow up with you and ask you about what that experience is like. And there has been some confusion about the distribution plan. Some states are saying, of course, they aren't getting enough of the vaccine as much as was promised. In the end, the states really will decide how the vaccine gets distributed. Are you pleased with the amount of vaccine that's being distributed and how quickly both of these vaccines have been approved?
Oh, well, yeah, obviously I want everybody to be vaccinated. But, you know, when we vaccinate healthcare workers, for example, intensive care nurses at my hospital, we can't vaccinate them all at the same time. When we vaccinate people, it has to be done in a slow, methodical, and safe way. It's more than just getting a shot walking away. Some people have to be observed for 30 minutes, and you have to be observed for at least 15 minutes. So it really has to be done in a logistical way to ensure the vaccines are stored properly, they're cooled properly, they're defrosted properly, and prepared properly. It just takes time to do. We will get there. And I always ask people to be patient when it comes to vaccinating not only everybody in healthcare, but in the country.
Many people, as you know, I'm sure, when it comes to messaging, about a third of Americans, according to a recent Kaiser poll, are concerned enough about possible long-term effects, the speed with which the vaccines were approved, and distrust of the government. They say they won't be vaccinated. What's your message to them?
Well, I message them as a couple. First of all, people are dying every day of COVID-19. You know, we have so much sorrow in this country from all the changes and the pain and suffering of COVID-19. The vaccines, the way they have been studied, are exactly the same way as we have done with traditional vaccines. The vetting process by 3 different review boards of scientists, and the way they're independently reviewed by the FDA and the CDC. I have the utmost confidence in the vaccines. And, you know, the learning continues. You know, the virus, we've only known about it for a year, and there's still some questions we have to answer about the vaccine. Most importantly, how long does the immunity last with the vaccine? And again, we will continue to learn more through 2021.
So a couple different groups of people in question. First of all, women who are pregnant or plan to become pregnant or are nursing. What about them? What's your advice to patients who are pregnant or might become pregnant?
Yeah, so my advice basically is to talk to your primary obstetrics provider. You know, it is true that pregnant women have not been in the studies for either the Pfizer or the Moderna vaccine. However, just because you're pregnant, that's not an exclusionary criteria, meaning that you cannot get the vaccine. It really is up to you to have a discussion with your primary obstetrician whether the vaccine might be right for you.
And what about people who have been infected with COVID and either still have the antibodies or don't have the antibodies anymore? Do you recommend they wait for other people to go first in the back of the line, or do you recommend they just go be vaccinated like everyone else?
Well, the short answer to that is they should be vaccinated. You know, when someone gets COVID-19, we do not know how long the immunity lasts for. Now, the CDC did give guidance on that, saying that some hospital systems could make the decision and say, hey, if you had COVID within 90 days, that you probably have a degree of immunity just to vaccinate more people. However, nonetheless, if you've had COVID, the recommendation is that you should still get the vaccination.
Is there a time period you need to wait? 90 days? Is that the time period?
Actually, it's not. As long as you don't have symptoms of COVID-19, nor are you in quarantine after a high-risk exposure. But theoretically, if you've had COVID 3 weeks ago and you've recovered from it, you would be eligible to receive the vaccination.
All right, Dr. Gastaldo, we really appreciate having you. Good luck tomorrow when you get the vaccine, and we look forward to talking to you again soon.
Thank you.